Before the MACI procedure, I would have pain intermittently with specific activities, and now that's really gone. I don't think about my knee as I progress through my day, as opposed to 3 months ago where I'd have to put thought into everything I did, not really being able to trust my knee. Now, I have no need at all for any kind of assistive device when I'm walking. Walking is comfortable. I can go up and down stairs without an issue. My biggest challenge is really strength. There are activities I can do way better than 3 months ago, but I still feel limited by my strength and endurance. So those things are coming along. I'm still going to physical therapy twice a week, doing a prescribed exercise program, mostly focusing on, strength of my hips, strength of my quad muscles, coordination and endurance exercises, and then do at least 1 to 2 additional days of strengthening on my own. What I could do 3 months ago, which was a big challenge, I now could do easily, and therefore I've progressed onto much more challenging exercises. Physical therapy is really good to have someone sort of rein you back in and remind you that, the progression is related to the biology of healing, not necessarily how fast or how motivated you are. I saw him right around the 6-month mark, and he did an x-ray of my knee. I also actually had an MRI at that time because he was just interested to look at the graft healing. He said he really couldn't be happier with my progress. Both of us are really focused on just continuing to work on my strength and endurance. For the first time since my injury, I'm able to focus on my fitness again. I'm getting cardiovascular exercise every day. I'm allowed to walk without restrictions. I can hike without restrictions. At 3 months, while I was allowed to be on a bicycle, it was more like pedaling a bicycle rather than using the bicycle for exercise. Now I can get on there and spend an hour and a half on the bike, pushing myself hard and, finally starting to feel some of those endorphins that endurance athletes like to feel. Being able to get on the bike and work hard and work up a good sweat, as much as I want, as often as I want, without restrictions, has just been great for me. Words cannot describe, how good it's been for me to be able to get back into a good, solid exercise program. My husband and I are taking one of my sons to Paris on vacation, and it was something that we had planned to do this past summer. But because of my knee, before surgery, I was really limited in what I could do, and I just didn't really trust myself to go somewhere and spend all day on my feet and walk on uneven sidewalks, etc. We were really waiting for kind of this 6-month mark when I knew that I'd be able to enjoy every step of it. Definitely for me, my next milestone will be going out for my first run. So you can bet that on September 15th, I will be going for a run. I'm happier now. I'm not so grumpy.
Indication for use. MACI, autologous cultured chondrocytes on porcine collagen membrane, is made up of a patient's own autologous cells that are expanded and placed onto film that can be absorbed back into your own tissue and is implanted into the area where the cartilage damage was removed. MACI is used for the repair of symptomatic deep cartilage damage of the adult knee that may or may not affect the bone. MACI should only be applied in the operating room to the person for whom it was made. The amount of MACI applied depends on the size of the cartilage damage. The MACI film is trimmed by the surgeon to match the size and shape of the damage to ensure the damaged area is completely covered. Multiple implants may be used if there is more than one area of damage. Limitations of use. The safety and long-term clinical benefit of MACI have only been studied in the knee joint. MACI has not been approved for use in joints other than the knee. The safety and effectiveness of MACI has not been proven for patients 55 years old and older. Important safety information. MACI should not be used in patients who are allergic to antibiotics, such as gentamicin or materials of cow, porcine or ox origin. MACI should not be used if you have severe osteoarthritis of the knee, other severe inflammatory conditions, infections in the bone joint and other surrounding tissue, or blood clotting conditions. MACI is not approved for patients who have had knee surgery in the past 6 months. This does not include surgery for obtaining a cartilage biopsy or a surgical procedure to prepare your knee for a MACI implant. MACI should not be used in patients who cannot follow a doctor-prescribed rehabilitation program after their surgery. The safety of MACI in patients with cancer in the area of the cartilage biopsy or implant is not known. Cancer cells could be expanded during the culturing process. Patients are not tested for infectious disease and may transfer infectious diseases to the surgeon handling the MACI implant. If your MACI implant is not sterile, your surgeon will be notified before your surgery. Conditions that existed before your surgery, including meniscus tears, joint instability, or alignment problems, should be evaluated and treated before or at the same time as the MACI implant. The MACI implant is not recommended for pregnant patients or patients who are breastfeeding. Use of MACI in children younger than 18 years of age or patients over 65 years of age has not been studied. The most common side effects include joint pain, common cold-like symptoms, and headaches. More serious side effects include joint pain, cartilage injury, meniscus injury, treatment failure, and osteoarthritis. For more information or to view full prescribing information, please go to maci.com.